What's the worst case you've ever seen in a hospital? I'm a nurse in a mid-sized city hospital. Been doing this job for almost 12 years. I've seen just about everything that can go wrong with a human body. But there's one case that still wakes me up at night. It started as a routine emergency admission. A 34-year-old man brought in after collapsing at home. His vitals were unstable, his skin pale and cold, and his heart rhythm erratic. The paramedics said he'd been complaining of chest pain for 2 days but didn't come in sooner because he didn't want to make a fuss. We got him into trauma bay 3 and started the usual protocols. His blood pressure was dangerously low, and his oxygen saturation was dropping fast. I remember glancing at the monitor. His heart rate flickered between 67 and flatline. It kept jumping back and forth, like the machine couldn't decide if he was alive or not. We gave him fluids, meds, oxygen, the works. Every time it looked like he might stabilize, his pulse would vanish again. Then one of the residents noticed something odd. His veins looked collapsed, but his stomach was distended, tight like a drum. We ordered an ultrasound, thinking maybe internal bleeding. What showed up on the screen didn't make sense. There was a massive shadow taking up nearly all of his abdominal cavity, like a balloon pressing on everything inside him. The attending called for surgery immediately. In the OR, the surgeons opened him up and found a ruptured aneurysm in one of his main arteries. But that wasn't the horrifying part. The cavity was filled with clotted blood that had been building for days, trapped under pressure. The second they relieved it, it burst out so forcefully that it hit the ceiling tiles. Everyone froze for a split second before moving again. They tried everything: suturing, clamping, transfusions, but the damage was too extensive. He didn't make it through the surgery. The entire team went silent after the code was called. I stayed behind to help clean the room, and for some reason, I found myself staring at the monitor still displaying his last recorded heart rate, 67 BPM. It just sat there, frozen on the screen long after he was gone. Like the machine couldn't accept it either. I've seen hundreds of patients pass away, but that one stuck with me because of how close it all was. If he'd come in just a few hours earlier, if he'd listened to the pain, we might have saved him. Medicine can do a lot, but it can't turn back time. And sometimes the monitor's stillness tells you more than any diagnosis ever could.